My name's Emma Hammett. I founded First Aid for Life, and we are the main providers of exemplary first aid training in southwest London. My background is nursing. I trained at St Thomas's an awful long time ago, worked in A&E and acute admissions and most medical and surgical wards, worked in paediatrics, medicine for the elderly, went on, worked in the community, Wandsworth Prison, I was working there, the Burns unit at Queen Mary's, Roehampton, and I then became a hospital manager at Hammersmith and Charing Cross, a hands-on manager for medicine. I had 8 wards, an endoscopy and outpatients, and then I went on and founded First Aid for Life, which I set up in about 2006, and we've got an excellent reputation. All my trainers are medical and emergency services professionals, and they all really care that when you come on one of our courses, that you go away with the skills and knowledge to confidently help in an emergency. So we're not in the business of just providing a certificate, we really care. And in line with that as well, anyone that's been on any one of my courses, or any of you, if you want to call me or get in touch or email me, I provide that support, long-term, ongoing. Things change in first aid, things get confusing. You get new adverts that come on and people think it's changed what the Resuscitation Council guidelines are telling us to do, and it causes a lot of confusion. So the idea is that you can get in contact with me. I can explain whether that is a change in practice or what you should do, what you shouldn't do, and how you can best help someone in a medical emergency. I do training for all sorts of individuals. I train an awful lot of parents, particularly parents, first-time mums and second-time mums who meant to do it the first time and didn't get round to it, and then they've ended up in a sticky situation and said, why didn't I do this earlier? I work a lot with the National Childbirth Trust. We set up the scheduled courses with the NCT that we run throughout London. And some of the things I quite often get asked are things like, what do I do if my baby's choking or my toddler is choking? So you need to be shown how to do that. There's resources on my website you can look at, and I can talk you through it as well. Or you can come on one of my courses, whichever you want to do. So we can show you how to hold them, show you how hard you have to hit them on the backs so that you aren't damaging them, but you are hitting them forcefully enough to get that obstruction out. People worry about head injuries. If a child bangs their head, which they will, children bang their heads, they don't look where they're going, they're the wrong height for everything, they are head heavy as well, so they will bang their heads, and it's really important that you know what to look out for and for how long, because it will save you unnecessary trips to casualty and unnecessary panics, as well as making sure that you do react when it is important and you need to react. So we'll be going through things like that. If you contact me, I will cover what you want to know. I set up First Aid for Life for all sorts of reasons. I really do care about first aid. I'm passionate about the difference that what you do, or what you can do in those first vital seconds and minutes, the difference that it can make. Take burns, for instance. If you recognise that somebody is burnt and you treat that area very, very quickly under cool running water, you can actually reverse some of the damage that's been done. So you can make a difference so that whoever has been burnt won't be scarred, won't have as much long-term pain, and can lead to a complete recovery. Whereas if you didn't know what to do, then the scarring and the trauma from burns is huge. So what you do in those first few vital seconds, and it's usually so simple, and using common sense and what you have around you, and having the knowledge to know how to react, can make a real difference. The feedback I have had from my courses is outstanding. and it's lovely. The difference that it's made. I've had people that have contacted me. One lady, she was in a restaurant and someone choked in front of her and everybody just stood there. And they didn't know what to do. And she was able to go in, save this woman. She said everyone gave her a round of applause in the restaurant because it had got to a life-threatening moment. And she phoned me straight after it had happened and she was crying. I've had parents who've had similar experiences with their children. I've had a nanny who had a child she was looking after had a febrile convulsion and she was petrified. But she said, I knew what to expect. I knew what it would be like. And boy, it wasn't as frightening as it would have been without that knowledge. And the difference that it has made to people, just in the confidence, in parents feeling confident that the nannies that they have employed to look after their children would know what to do should something happen. I mean, it's a huge responsibility and I take it very, very seriously.